In the tumultuous landscape of the COVID-19 pandemic, it's crucial to remain abreast of the latest updates from authoritative sources, such as the CDC. These updates are not merely abstract policy changes, but have tangible implications for individuals and communities worldwide. Throughout this comprehensive exploration, we will delve deeply into the nuances of the CDC's revised COVID-19 guidelines. By dissecting and elucidating key elements, we aim to equip you with the knowledge necessary to make informed decisions amidst the evolving challenges posed by the virus. The CDC's decision to revise its guidelines reflects a meticulous analysis of the evolving impact of COVID-19. By examining trends in hospitalization rates, mortality statistics, and epidemiological data, the agency has honed its response to align with the shifting dynamics of the pandemic. Moreover, understanding how COVID-19's position has fluctuated among the leading causes of death offers valuable insights into the effectiveness of containment measures and vaccination efforts. Central to the CDC's updated guidelines is the principle of personal responsibility. By shifting towards a framework of respiratory virus guidance, the agency recognizes the multifaceted nature of respiratory illnesses, encouraging individuals to take proactive measures, such as staying home when symptomatic and adhering to preventive practices like mask wearing and social distancing, underscores the importance of collective action in combating the spread of COVID-19. The diverse responses of individual states to the CDC's guidelines provide invaluable case studies for assessing the efficacy of public health interventions. States that have successfully adapted their isolation period guidelines without experiencing significant surges in COVID-19 related morbidity and mortality offer valuable insights into best practices and areas for improvement. By studying these regional variations, policymakers can refine their strategies to better protect their populations. Healthcare workers constitute the vanguard in the battle against COVID-19, necessitating specialized guidelines to safeguard their well-being. While the general public receives generalized respiratory illness guidance, frontline workers require specific protocols tailored to their occupational hazards. By prioritizing infection control measures and ensuring access to personal protective equipment, healthcare facilities can mitigate the risk of nosocomial transmission and protect their staff and patients. As our understanding of COVID-19 evolves, so too does our knowledge of its clinical outcomes. The decreasing severity of COVID-19 outcomes, particularly in vulnerable populations such as children and vaccinated individuals, reflects the collective impact of vaccination campaigns and therapeutic advancements. By monitoring trends in multisystem inflammatory syndrome and post-COVID complications, researchers can refine treatment strategies and enhance patient care. In a significant shift, the CDC's updated isolation guidelines now emphasize a symptom-centric approach to managing COVID-19 cases. The focus has moved from strictly defined isolation periods to a more comprehensive consideration of an individual's symptoms. This means that people are now encouraged to prioritize managing their symptoms and only return to their normal routines when they feel recovered. This nuanced approach attempts to strike a delicate balance between public health needs and individual well-being. It provides clearer guidelines on when it's safe to resume daily activities, all while aiming to minimize the risk of further transmission. This shift in policy shows the adaptability of our healthcare system in response to this evolving pandemic, and the constant strive to provide the most effective guidelines for the public. As we journey deeper into the CDC's new guidelines, we encounter a crucial aspect that deserves our undivided attention: the unique needs of high-risk groups. These are individuals whose health conditions or circumstances place them at a heightened risk of severe illness from COVID-19, including people who are immunocompromised, elderly, or pregnant. The CDC's updated guidelines have taken a commendable step in recognizing and addressing these needs. The new guidelines offer targeted interventions for these high-risk groups, providing them with a roadmap that is not only based on common symptoms, but also considers their unique vulnerabilities. But it doesn't stop there. The guidelines also address the unfortunate disparities in access to healthcare, which tend to disproportionately affect these vulnerable populations. By implementing equitable strategies, the CDC is striving to ensure that everyone, regardless of their personal health circumstances, has access to the protection they need against the virus. This is a testament to the inclusive approach taken by the CDC, ensuring that no one is left behind in our collective efforts to combat COVID-19. In the next scene, we will continue to explore the implications of these revised guidelines. In our exploration of the CDC's guidelines, we've arrived at a critical convergence point where science meets policy. The CDC's commitment to evidence-based decision-making is the cornerstone of these guidelines. By fusing together findings from epidemiological research, clinical trials, and real-life observations, the CDC formulates recommendations that are deeply rooted in scientific rigor and empirical evidence. This iterative process of inquiry and adaptation ensures that public health interventions are dynamic, capable of responding to newly emerging threats and changing circumstances. It's through this rigorous approach that the CDC ensures the guidelines are not just theoretical constructs, but practical tools that can be effectively implemented in diverse settings. By bridging the gap between science and policy, these guidelines offer a comprehensive approach to fighting COVID-19 that is both informed by the best available evidence and adaptable to the needs of different communities. This commitment to evidence-based decision-making is a testament to the CDC's dedication to protecting public health. In the next scene, we will wrap up our deep dive into the CDC's revised COVID-19 guidelines. In this rapidly evolving landscape of the COVID-19 pandemic, uncertainties are inevitable. The CDC's guidelines acknowledge this inherent uncertainty and strive to navigate it with transparency and nuance. As we delve into the complexities of viral transmission, the efficacy of various interventions, and the potential long-term impacts of the virus, the CDC's approach to risk communication becomes paramount. By fostering an open dialogue, they are not only acknowledging the uncertainties, but also actively working to demystify them. This transparency fosters trust and encourages informed decision-making among the general public. It's a delicate balancing act between providing necessary caution and avoiding unnecessary alarm. The CDC's commitment to this nuanced approach of risk communication underscores their dedication to protecting public health, even in the face of uncertainty. As we conclude our deep dive into the CDC's revised COVID-19 guidelines, let's remember the importance of resilience, adaptability, and continuous learning in our collective fight against this global pandemic. As we continue our journey through the CDC's revised COVID-19 guidelines, it's crucial to recognize the importance of resilience and adaptability. These two qualities are not just about weathering the storm, they're about learning, adapting, and emerging stronger in its aftermath. The COVID-19 pandemic has tested our global resilience, but it has also provided us with invaluable lessons for the future. In this world of uncertainty, the CDC's guidelines serve as a roadmap, not just for the present, but for future public health crises as well. They highlight the importance of a proactive response, collective action, and continuous learning. These are the pillars of resilience and adaptability. As we look to the future, it's clear that our approach to public health must be as dynamic as the challenges we face. The CDC's guidelines remind us that we are a part of a global community, and our actions have far-reaching implications. By cultivating resilience and adaptability, we can better prepare for future challenges and mitigate the impact of infectious diseases. So, as we navigate the complexities of the COVID-19 pandemic, let's take these lessons to heart. Let's continue to learn, adapt, and grow. Because our collective resilience and adaptability are not just our best defense against this virus, they are our greatest assets for a healthier future. As we come to the end of this comprehensive review of the CDC's revised COVID-19 guidelines, we hope you found value and insight in this deep dive. If you found this video informative and helpful, please give it a thumbs up. Your support helps us continue to produce more of this content. And if you haven't already, consider subscribing to our channel for more in-depth analysis and explanations on a wide range of topics. We're always working on new content, and we'd love to have you along for the journey. As always, we appreciate your time and attention. Thank you for watching, and we look forward to seeing you in our next video.